Okay, hello everyone. Welcome to the IDOS webinar today of the Oral Health Meets Health Opportunities and Challenges. Please welcome Dr. Professor Rodrigo Mariño from University of Melbourne, Australia. Dr. Rodrigo is currently the president of the IADR E-Oral Health Research Network and a member of the editorial board of 3 international peer-reviewed journals. Recently, he was the editor of a special issue in Telehealth and Dentistry and the Journal of the International Society for Telemedicine and E-Health. We are so pleased, Dr. Rodrigo, that you accepted our humble invitation to be with us today, and you have the floor. Thank you.
Okay, thank you very much for the invitation to this webinar. As I said, this is you are making history with me because it's the first time I participate in a webinar. As you mentioned, I am based in Melbourne. Today, I mean, now is the night in Melbourne, so it's very dark in winter, so it will be very different in other parts of the world. Well, as I said, thank you very much for the invitation. What I will talk today is a little bit of how technology, information and communication technology, is being introduced in health and dentistry, and what are the opportunities and challenges that this technology provides, with particular focus on mobile health. The structure of today's presentation, I will make a general introduction to what is teledentistry, why do we do that, what are the different forms of telehealth and teledentistry, and some information from the literature review of teledentistry and examples of what is happening here in Australia. As you know, Australia is a highly urbanized country. It's a huge continent, but the population is not large. It's only 23 million in the size of a country which is about or the same size or similar size of Brazil and United States. So it's the density of the population is very low. Most of the people live in big cities, in 5 or 6 big cities, but some still a significant proportion lives in areas of the country apart from for non-metropolitan areas. And this is important for the topic that we are talking now about, because those population that do not live in main cities, they don't get the full, they don't get similar access to oral health services, and information and communication technology can provide a solution for that, and is providing actually a solution for that. The other another characteristic of Australia is that the population is aging. There is as we mentioned before, a large urban and rural divide, where most of the facilities are facility health and education facilities are in main cities, but less in rural areas. The rural people living in rural communities are generally older than those living in urban areas, because of the socio-demographic that people tend to move. And another important characteristic of Australia is that 26% of the population was born overseas. So in general, 1 in 4 was born overseas, which makes the issue of information and communication technology very relevant for what it's doing. Now, even though most of the population live in cities, in large cities like Melbourne, which is about 5 million. The cities tend to be a widespread. So again, that creates another limitation for access to health and services, which again, this technology can provide a solution. In general, for years, human beings have been trying to communicate information through distance. And you may remember that we see the use of fire to indicate or to communicate something to the distance, or the use of smoke signals, or the use of drummings. All that was a way to communicate information from one place to the distance. And the picture I'm showing here is from the South America, South America, from the ancient civilization of the Incas, and they use this. These are called quipus, and they use different length of different lengths of strings and different colors and different width and knots to communicate information. Unfortunately, we don't know what they mean, because the civilization was conquered by the Spaniards, and they lost the information on that. It is thought that they use this method to communicate administrative information. So it is possible, although we don't know, that this information these quipus provide information on birth rates, or information on mortality or diseases, etc. So it is possible that there is some health information in that. And again, they use this to communicate information through the wide. The Inca Empire was very wide, from what is now Ecuador to northern Argentina, and about half of Chile, including Peru and Bolivia. So it was a wide empire, and they used this to communicate information. So as I said before, the use of or the idea to communicate health information to a distance is not new, has always been attempt. I don't know if you have read the book Love in the Time of Cholera from Garcia Marquez, a Colombian writer. In that book, also they use a way to communicate health issues using the black flag, which indicate that the ship had cholera. And they use this for a different purpose in the book. I mean, if you haven't read, I encourage you to read it, and I will tell you how they used it. But the purpose of the black flag was to indicate that that ship has a health issue. So as I said before, it's not rare or not unusual that in the past also they use different type of technology to communicate. But now we talk about telemedicine or telehealth or e-health, when we more specifically we use electronics or electronic communication to provide or to communicate health issues. And this is another example in traditional or indigenous Australia, that they use storytelling and songs to communicate information, health information. In Australia, one of the first examples of the use of technology is from the 19th century, when there was a fight, and some person were hurt, and they used the telegraph to communicate information from Adelaide, which is in a different state in South Australia, to communicate or give information to the telegraph station when this person was being wounded. Also in the American Civil War, there are example in that's 1860s. There are example of use of a telegraph to provide health information. In the first recorded or the first time that the term telemedicine was used is in the 1920s, 1927. And this person was talking about the transmission of photographies. I don't know if you remember, but if you are old enough, you would remember that in the newspapers, the pictures in the newspaper were transmitted by dots. So more density of dots was darker and less density was more clear. So they used this to transmit that. So this person thought, well, if we can send pictures in that way, we can also use radiographies or send information in a similar way. So that was the first time that the word telemedicine was actually used. And there are also examples from the 1920s of, in those years may look or sound like science fiction, but if we try to think in 21st century's technology or experience, you will see that this is not very different to what we are using today. So in the 1920s, there was this idea that they could communicate with sensation. Can you see in the image in the left that the medical practitioner has in the hand some instrument, and that instrument is like where is transmitting the sensations to the hand of the doctor who is performing the examination. So again, about 100 years ago, already that possibility was considered, although again, in those years was more like science fiction, and today is actually reality. And that takes us to the issue of e-health. And there are several definitions of what e-health is, and this is one from WHO. And WHO defines e-health as the rapidly evolving discipline of using computing, networking, and communications, methodology, and technology to support the health-related fields such as medicine, nursing, pharmacy, and dentistry. Another definition is provided by the European Union, and this one defines e-health as products, systems, and services that go beyond simply internet-based applications. They include tools for both health authorities and professionals, as well as personalized health system for patients and citizens. And I like this definition because there are a number of elements in that definition. One is that it talks about tools, and also talk that all the e-health are about application for health authorities, professionals, and patients. So it's not only for a limited use, but for the whole range of possibilities. So there are tools that can be used by health authorities, by health professionals, and patients to handle or improve health. And this is another diagram which clarify the issue of telehealth and telemedicine, how they are part of e-health. So in the right bubble is all telehealth, which is all the video conference or website delivering health information, and within that telehealth bubble, there is a telemedicine bubble, and we can also include telenursing or teledentistry. Is belong to that to the telehealth. Then we have all the issue of health informatics, which is about providing information to support healthcare, and health telematic that combine the use of sending information and providing health-related activities to or distant to patients. And all that is what is e-health. But in general, we tend to talk about e-health or telehealth or telemedicine as they were synonyms, but they are not. E-health encompasses all the issues of telehealth and telemedicine and teledentistry. This is a diagram that provides some major issues of application of telehealth, and we can see in the left, teleconsultation, telediagnosis, teletreatment. Then we have all the issues of teleeducation and teletraining, telemonitoring, telesupport for practitioners, teleadministration, the use of technology for administrative purposes, for scheduling or managing appointments. And then we have all the area of consumer and medical and health information, like a website that provide health promotion information or any type of health information. So when we talked before about the definition, we talk about tools, and I think that is very. I mean, it's important, as I will emphasize later, because we tend to think about or the use of technology mostly as about to provide treatment, but we tend to forget other tools that are that also needed to provide those services. And among those tools that are more health related, we have all what are the health information networks, electronic health records, which is an issue that is expanding, all telemedicine services, teleconsultation, telediagnosis, personal wearables that can check some vital function, communication system, again, for teleconsultation or telediagnosis, health portal that provide information to practitioners and also for patients. And then we have all this other set of tools that we talk less about that, and they are not as well defined and not as well researched as the technological part. And these are all the rules, regulation, and guidelines, all the definition. What is, for example, a teledentist? What is the area of expertise where he or she operates? What technical specification and standardization he or she needs to use? How policies and strategies support his or her work? So all this, the introduction of technology create again all these other challenges that we are not or we are less prepared to identify and provide a solution. Technology moves very fast. If we think about how was technology or computer technology 5 years ago, mobile phone, for example, and how they are now, we will see the fast advancement of technology, but regulations, guidelines, they move less fast. So there is a need to catch up or there is a challenge to catch up with this fast technological development. But these are also e-health tools that will provide or can help us to expand the provision of services. Now, one of the areas that is probably expanding as a fastest pace is the use of mobile health. So mobile health are all these applications that we can use for a number of purposes. For example, to monitor, to prevent, for early detection, for diagnosing, or for management of diseases that are being developed constantly. A review of applications for mobile health indicate that in the year 2017, this is 2 years ago, they have 325,000 apps in health. And there is or a calculation or an assessment that is about 200 apps are being added every day. So it's a fast moving area, and probably the most fast expanding area of the use of technology. Of course, this 325,000 are not on a few of them only probably are in oral health, but again, tell us how fast they are developing, and we will talk a little later of which are the consequences of this fast development. So, well, when we talk about application for health, are all these applications that can be used in mobile devices like a mobile phone or tablets or computers. And if we think, and I mean, you're following the news this day, there is a lot of discussion about the use and the risk of using mobile phones. But if you think about, and well, a mobile phone is a very sophisticated piece of technology, and we tend to think that all phones, not the smartphones, that the old technology, they are not as good as, well, of course they are not as good as what we have now, but still they are a very sophisticated piece of technology, even though they are not smart. So a smartphone are providing constantly information and sending data about what we are doing, and provide some algorithm that can predict our behaviors. And if you have one mobile phone, and I'm pretty sure that most of you will have one, if not all, they can tell you that you are, I don't know, listening to a webinar maybe, because of the information that the phone is sending. But going back to the uses of the apps, this mobile application can use it to infer some behavior, to understand behavior, to monitor and predict and provide interventions and personalize health intervention to improve the health outcome. Even though, as I mentioned before, there are some risks and challenges of their use. Another area that is increasing lately is the gamification, or G-health. And G-health, again, is another powerful tool for healthcare, in particular for prevention, but also has been widely used for education, and education of, students, to train dentists. There are probably as many applications for training purposes than as they are for healthcare, at least in dentistry. So gamification are ways or applications that can promote healthy behavior, promote behavioral change. They are used, as I said, for training and education, and they can get people involved in discussing new ideas and providing feedback for the community. Now, even though that these are very helpful tool, there are some barriers for the introduction of those technology, and those barriers can be grouped into 4 categories. One is technical, other is behavioral, organizational, and economical. Between the technical is the issue of connection, the internet connection, that allow for a fast, two-way interactive communication. In some places, or in some part of the country, some area of the country, the access to a fast internet connection is not as available as other parts of the country. So we need to consider that when we are thinking or providing telehealth solution, because not every part of the country have the same access, or in different countries also may have different access to internet connection. The other technical limitation is the interoperability of applications. Different organizations or different developers or different companies, they develop their own system, and those systems, they don't talk between the other, so that can create also another barrier. But there are some attempts to improve the interoperability and also to improve the internet connection. So, and we can expect that in the future these barriers will decrease. Another barrier is behavioral barriers. Some practitioners, they need to develop new skills to use this technology, and for some could be faster or easier than others. So that is another barrier. Organizational. As we mentioned before, the pace of technological development is so fast that all institutions need to keep pace on that and replace equipment to keep with the advancement, and that create an issue of sustainability, of cost of the technology, which is also could be a limitation or a barrier for the introduction. There are all the issues about privacy, confidentiality, and security and liability issues that come with the introduction of the e-health, of telehealth, and regulator or organization that regulate the use of these devices need to keep pace for this challenge. And as I said, the technology moves fast, and sometimes it's possible that they don't keep pace with that, and that creates an issue of lack of use, because if somebody or a practitioner doesn't feel covered by or protected by insurance, could be that they not introduce the best technology. So again, that's a type of barrier that we need to also consider. Another challenge or barrier to introduction is organizational. Now we can provide, use technology to provide teleconsultation across state or even across international borders. And in some countries, even within a country, for example, in the United States, not all the graduates from one state can practice in another state. There is an issue of agreements and guidelines they have to follow. But let's put that from one country to another. There are some instances where two countries have agreed to cooperate in this, but it may be not in all of them. But in the past was not much of an issue, because that possibility was not as used or possible as it is now. Another issue is the use of non-oral health provider or non-healthcare provider to provide some time of or some sort of health intervention, because it's possible under the guidance of an expert using telecommunication technology, which was not possible before. So there is a need for new regulation to cover that, so we can reduce or increase access to health and reduce inequalities in health, health and healthcare provision. So again, in summary, there are licensure and regulation issues. There are some ethical issues, and the ethical obligation to use the available technology and tools to reach all the population. So that's, again, I mean, it's a legal issue, but also it's an ethical issue, because if we don't move in the same path, we are denying to those who live in remote areas, for example, to have access to a specialist that is only available in the city. Another barrier is reimbursement of services. I mean, there are several examples in the literature that only when a reimbursement mechanism were introduced, health practitioner and oral health practitioners start providing that services. So again, if we don't introduce the way to pay for the services provided, then even though the technology is there, it's not going to be introduced. Again, the issue of liability, because can provide some issues with insurance that may not be covered, and that may have also economical impact. So even though technology is available, there are some other issues that need to be addressed, so we can have the use or have the full use of the technology to provide or improve the health of the community. Now we are going to go back to or focus a little bit more about the teledentistry. And this is the definition of teledentistry. Of course, it's not different to any telehealth modality, but applied to dentistry. So it is defined as a body of knowledge that focuses on the organization, management, and distribution of information in support of dental education, practice, research, and administration. So this is what is defined. The reason for doing that is because we can enhance early diagnosis with using teledentistry, may facilitate a timely and appropriate treatment of oral disease and condition. Also can reduce the isolation of practitioners that practice in remote or non-metropolitan areas, and with that we can reduce healthcare inequalities. For example, as I said before, given access to a specialist or specialist advice in rural areas or underserved areas. As I mentioned before, in cities, large cities like Melbourne, most of the specialists are in the city, in the downtown, but those who live in the outskirts of the city have less access to specialists. And this is a way, I mean, this technology is a way to improve that access. Now, a little bit of background in teledentistry. Again, it's not something new. In the 1950s, was used for teleeducation. We use, or in the United States, they use television transmission for education. But with the introduction of computers and other communication technology, the expansion of the application of teledentistry has been since the 1960s. And probably the last or the largest teledentistry project is currently undertaken by the U.S. military, because they have a system to provide health in the different places where they operate. And in comparison to other areas of telehealth, or like telemedicine or telenursing, teledentistry has historically a slower adoption, but is gaining pace now and is expanding. If you do a search, you will find maybe 2,000 papers or reference about telemedicine, and then a few a lot few in teledentistry, but you can see that there is an improvement in the last few years on that. Now, the application of teledentistry, again, they are not different to the one that I mentioned before in telehealth. And I have here teleconsultation, telediagnosis, teletreatment, teleeducation, and teletraining. And if you see, teletreatment is a bit gray. And in the past, it was even less clear, because the provision of or teledentistry needs to provide treatment. And the issue of remote or robotics was not very well developed in dentistry. But last year, or the year before last, there was this development in China. They developed a robot that they can put implants in patients, and they developed that because of a shortage of oral health professionals. So I'm not saying that this is the solution for dentistry. I am a public health practitioner, so I believe in prevention and health promotion. But I pointed this because something that we thought that could be not possible today is actually being experimented in some countries. So and I can tell you, it will not be far when this is more widely taken by the health services. And I mean, I don't want to discuss much on this, but if you think about this, will create or will challenge the training that oral health professionals are having these days, because they will need to have different type of skill to operate this kind of treatment. Well, these are some of the application of teledentistry. This is in this diagram, I tried to put everything together using the definition that from the European community that talk about tools that are available to provide telehealth. And we have in the upper left corner, you can see all these technological, behavioral, organizational, economical barriers that need to be addressed, because addressing those issues are also tools that can provide wider application of teledentistry. So we have tools for the patients, tools for the general dental practitioner, and tools for the specialist. And well, they have different tools. Sometimes some tools are common to everybody, but others are just available for either the patient or the GDP or the specialist. But the issue of in the introduction of information and communication technology is expanding, and is probably, if we think about this diagram, maybe it's more complex than what it is, but you can see that there are information and possibilities that may have been available before, but not in a way that we have these days. What I will do now is present some information of the project that we have been working here. And this is one, in G-Health, in what I mentioned before, we did a review of gamification in oral health. And as I said before, what we found was that is not as extended as in other areas of health. that there are some experiences for teaching purposes, for the issue of teaching and training oral health professional. There are not many. I think I don't remember exactly, but I think we've identified some 15 or 16 different studies in oral health, and about half were in education, in teaching oral health to oral health professional students. And the other interesting finding was that not all of them provided better results as traditional modalities. Of course, with using gamification, there are a number of potentially use or potential benefits, but in terms of the outcome, they are not very different than using conventional tools. And this is also what is happening in Australia. In Australia, we have a public health insurance. It's called Medicare. And in 2011, they introduced some financial incentive for medical practitioners to use telehealth. Dentistry was not part of that. That initiative was ended in 2014. Still, there are some Medicare benefits that can apply to teledentistry, and there are some regulation on that, or some limitations on that, and is, for example, in those who live in residential care facilities, or they are patients of Aboriginal health services. So there are some still some publicly funded application, but it's not as wide as it was before. Yeah, there are 23 health items that can be included. Again, dentistry is not part of the scheme. I mean, there are some, for example, maxillofacial surgery is included, but it's not in general. There are some patients that they are lip and cleft palate patient. They can be reimbursed from this scheme, but in general, it's not widely or it's not part of that. These are again some initiatives that are in telehealth in Australia, and telemedicine, and there are some examples of teledentistry. Probably each state in Australia has some teledentistry project going on, but it's not widely. It's a project. It's not a program. It's not widely implemented. And as it was mentioned at the beginning, there is a recently published a special issue in teledentistry in the international in the Journal International Society for Telemedicine and E-Health, and there we describe the examples of 6 or 7 different countries, including Australia. And then the Australian experience is from the state of Victoria, where Melbourne is, and they describe what they are doing there. But again, as is highlighted at the bottom, is not part of the mainstream health delivery system yet so far. In 2012, the government introduced the personal or personally controlled electronic health record. That scheme was voluntary, so everybody have the possibility to join that system. but after 3 years, in 2015, not many patients have been registered in that. So the scheme was terminated or changed in 2015. And now we have what is called My Health Record, where here you are in My Health Record unless you decide not to be. So that so everybody was there unless they decided not to chair or be part of this. But again, dentistry is not part of My Health Record. So any record in the public system or the private system of oral health services is not part of My Health Record. So there is no information of oral health in what we have now. So again, dentistry is lagging behind the advancement of or the potential use of these facilities. So in conclusion, teledentistry is growing in a consistent fashion. I emphasize that teledentistry cannot provide answer for everything, in particular for treatment. But again, this is, in my opinion, is just a matter of time. In the next few years, we'll see that there are some possibility of distant treatment. But the main point is that teledentistry will not be part of the healthcare delivery system if there are no appropriate health policy and strategies. There is no political support for that. The research is not promoted. They are not developed best clinical and public health practices, and these tools are not part of the training of practitioners at the university. So it's also essential that those who practice this have a full grasp, so they understand and they are trained for or before all this technology reach the full potential. Oral health professionals must be trained in the use of teledentistry, as I mentioned before. The way that oral health professionals are trained now may change dramatically in the next few years. We always need to think about the possibility of the digital divide, that we need to challenge assumptions that we have about young people being computer literate, have computer literacy, because they may not be the case. So we cannot assume that. And again, it's a role of dental school to provide training for new cohort of oral care professionals, but also to train previous cohort in the use of this technology. Research is basic on that, because any service that we provide has to be evidence-based. And for that, we need to provide the research evidence that we are using this technology in the best way. And remember that I mentioned that there is not always the evidence that they have, they are better than conventional. But of course, that doesn't mean that it shouldn't be used, but we need to know which are the limitations. And George Mallory he died, as you can see in this day, yesterday, in 1924. He was the first person who climbed the Everest, or assumed to climb the Everest. And it is said that when somebody asked him, why do you want to climb Mount Everest? He said, because it's there. And this go back to research and the use of technology. Not because it's there, we have to use it, because the consequences could be very severe, as with for George Mallory, who died in the Everest. So research is key. we need to demonstrate that that the using of new technology is provide a better or improved outcome. We need to demonstrate that it's cost effective. We need to explore in what kind of intervention and which kind of scenarios they work better, and we need to include in the training of new cohort of oral health professional, and check which approach or learning model works better, again, with research. And for research, as I mentioned before, there is a newly created or relatively newly created network at the IADR, the International Association for Dental Research, with the e-oral health network. That is a group that put together researchers from different parts of the world that are working in this in this domain, in information and communication technology in oral health. So we can expect that teledentistry will follow the pattern of other areas of health, but and future cooperation with the public sector and research will make available the benefit of new technology to be used, and this is potentially can reduce health inequalities and improve access to health as a human right, and improve the quality of life and social participation. And to finish, I will show you some of the example of the experience that we have done here at the University of Melbourne. One was using telehealth in those living in residential aged care facilities in Australia. Not many dentists or oral health professionals go to residential aged care facilities, so it's rare that they receive the appropriate oral health care. So we thought that this the use of this the teledentistry could be a good alternative for that, and we train nurses to manipulate the dental cameras, so we can get the information from the patient and develop a treatment plan. Of course, we didn't have the resources to provide treatment, but at least we finish with the treatment plan. That I mean, we move one step forward, because at least everybody has the information needed. For this training, we used 3 nursing homes, and we test different modalities. One was in Melbourne, was very close to the university, so it was a metropolitan area. The other one was in metropolitan Melbourne, but in the outskirts of Melbourne. It was about maybe 45 minutes from here, but still is metropolitan Melbourne. And the third one was in rural Victoria, the state of Victoria. So what we did here was to train the nurses to manipulate the camera, and then we developed the treatment plan, and of course that was successful. And also we test the quality of the examination, repeating some of the patients' examination with conventional examination, and we compare the treatment plan developed using both methods. And there is, of course, a loss of quality with the use of the intraoral camera, but that reduction of information was not that made the system useless. And here is how we operate, and developing the nurse or the tele or intraoral camera or operator, manipulator, and sending information to us and developing the treatment plans. The other project that we ran here was to see if we could use this technology to reduce the need of trips from those living in rural areas and need to come to the Royal Children Hospital for evaluation. We try to test if we can use this technology to reduce that trip, and of course we could demonstrate that this is possible, and by doing this we can, and let me show here, by doing this we can reduce, for example, in some cases they did the checkup and they say come back in 6 months or 12 months, etc. But in other cases it was not possible to do, and the teledentistry did not replace the actual face-to-face examination. And in other cases there were some they needed to do bring some X-ray that didn't have, or for some reason they could not, even if they come to the city, they could not be treated because there was some missing. So we demonstrate that by the using of teledentistry, we can improve the service provided. After that, we try to model the implementation of what would happen if with all the rural patients we used teledentistry using the example, and our conclusion was that we can save up to 5.3 hours per week by using teledentistry. And of course, that time, teledentistry is being used in a desk with a computer. So the dental chairs are used for different purposes. So there are a number of benefits in the use of that, and some of them are economical benefits. This has been published recently. The other example is the mobile health, and here we try to see if we can test for the concentration of fluoride and calcium and the pH using the mobile phone, and we developed this model, and actually was successful, but we haven't progressed much. And here in the right, you see the current apparatus to check what we could do by using the mobile phone. So I think there is potential in this app, but we haven't. I mean, we just developed the prototype. And the other one is the dental trauma tracking, and here we are trying to see if we can improve the epidemiological surveillance of dental trauma. And the reason for that is that most of the cases, most information that we have on dental trauma are from cases that get to the hospital or get to the dental clinic, and those are the more severe cases. So all those cases that are not as severe are lost, and the information that those cases can provide is lost. So we developed something, an app, among the 200 that are developed every day, as I mentioned before, to see if we can collect information from all the cases that happen at school or at gyms or at swimming pool, etc., so we can have a better information on dental trauma. And the application has two systems. One is the app, the mobile application, and the other one is a database where all the information is collected. And here is one of the screens in the mobile application. We follow the International Association for Dental Trauma recommendation of the type of information that should be collected in a trauma event, and we convert that into a mobile application. And then we have the web application where all the cases are being stored, so we can analyze that data. This application has, again, it's being pilot now, and it has been published. The first evaluation of that has been recently published. And with that, I think I finished this presentation, and I will be happy to answer any question that is there.
Okay. Thank you so much. I'm sorry. Okay. Thank you so much, Dr. Rodrigo. It was extremely informative and interesting webinar. I have to say it on my own because I didn't expect all of this information, to be honest. So I would like to go through the questions that we have received so far. I think we get a bunch of them here. Okay, so the first question is from Ali. He says that what are the gamification mechanism and tools that are that you usually implement and use in teledentistry and oral health practice? So he's asking about the gamification mechanism and tools that you are usually implementing or using in your practice.
So which are the limitations? Sorry?
No, he is asking about the gamification.
Gamification, okay.
Yeah, the gamification mechanism and tools.
Yep. What we, I mean, you can use games for basically any to improve or modify any behavior or to provide information to improve knowledge and in oral health or any activity. Now the tools you can use it as a mobile phone or a tablet, but for that you will need to work with a developer, a computer developer, and probably you will need to work also with a teaching developer, so they can convert your ideas or what you or the objective of your project into something that can be translated into a mobile application. So and that again emphasized what I was mentioned before, that the type of skills that the future oral health professional will have or will need to have in the future could be very different to what we have now. On that line, we are working on a review of games in oral health, and we expect to have this finished in the next month or so. So we will submit to a publication. So we will give some more information on the use of games in oral health. But again, if you compare the use of games in other areas of health, teledentistry is, or dentistry, oral health is lying behind that.
Okay, thank you for the clarification. Okay, the second question is saying that can teledentistry solve the big lack of dental workforce in various low-income countries?
In what type of countries?
In the low-income countries.
Low-income, yes. Well, well, I think yes. The answer is yes. Of course, there is an issue of cost, but I mean, technology have reduced cost so much. I mean, a computer 10 years ago was $3,000. A laptop computer was $3,000. Now you can buy a laptop for $200. So there is always a reduction in the cost of the technology and improvement in the use of technology. I think even though there may be some barriers, economic barriers, I only see that decreasing in the future.
Mm-hmm. Okay, so I think it's clear now. And the following question is saying that do you know any universities where healthcare students are also actively using telemedicine or teledentistry when they do outreach projects to rural areas?
No, I don't know. I don't know any specific one. I know that there is. I mean, again, if you compare or in my experience, teaching in dental students 5 years ago, there were a few students that have a laptop that were taking note in a laptop, and now everybody is using laptops. So the technology is being introduced. It's being expanded and introduced everywhere. But again, I don't have experience that they use this. I don't have knowledge that they use this technology for when they treat patients in rural areas personally. But it may be that they are testing or piloting some system somewhere.
Okay. So I think this question is the last question. It's about the Middle East. So it's kind of long question, and it has many parts. So I'm trying to read it as had been said. So it says that in Middle East we have barriers between community and healthcare providers, which initiates many problems as violence against healthcare providers, especially dental practitioners, because of lack of communication. Is there any research or data to the teledentistry contribution in enhancing the dental service in Middle East? This is the first question. Like, if you know any data or research that had been conducted on the teledentistry contribution to enhance dental services in Middle East.
In the Middle East?
Yep.
Well, I know that in Jordan there was a project in teledentistry.
Mm-hmm.
I don't know how wide application is that. But I think you mentioned also the issue of communications.
Yes.
Lack of communication.
Yes, he was saying that the lack of communication between the community and the healthcare providers creates a lot of issues. I mean, a lot of miscommunication and misunderstanding that leads to violence.
Look,
so,
the issue of communication is very important, and even more with the introduction of technology, because that changed the dynamic of the patient provider or a student teacher interaction. And we have to be very careful how we handle that, because this issue will change how things are done. I mean, in the future, or not in the future, I mean now, with the use of computers and all the data is being input in computers, actually the provider may be talking to the computer as opposed to be talking with the patient. So again, I mean, there are a number of issues that are changing how we interact with patients, and we need to be aware of that and provide some intervention or changes on how we do things. Otherwise, with all this communication technology, which are supposed to improve communication, will finish deteriorating the communication and communication skills that health provider should have. So again, I mean, as I said, I mean, there are a number of tools, and we need to concentrate in the technological aspect, but also there are a number of other issues that will make this technology accessible and successful that we need to address at the same time that we're implementing new technological solutions, because otherwise we can lose some aspect of the interaction and reduce the quality of our intervention just because we didn't apply the changes or modification that require with the introduction of the ICT.
Okay, that's perfect. The second part of the question, which is the last part as well, I think that what is the starting point to teledentistry to be implemented in a totally new environment? I think he was also asking about the Middle East. I mean, as a region which has no much initiatives in teledentistry, what could be the starting point to
look? When we did the study with teledentistry in nursing homes or residential care facilities, we took a special, care to use existing technology to demonstrate that what we have now can allow us to do or provide that type of services. So we basically have an intraoral camera, which already exists, an intraoral camera with some software, but those exist. We use we can use this type of like Hangout or Skype, or there are a number of other communication platform that could be used, that already exist and could be used for that purpose. So I think the main thing to start implementing that is check what is available in the domestic market and what can be implemented, and check the regulations also, because again, this can you can put yourself at some type of legal or create some legal issues with the implementation of this technology. And the other thing is that, and that was some of we experienced that also, is the bandwidth, because the amount of information that we are transmitting may not cope with the bandwidth that the local bandwidth. So yeah, you need to check what do you have there. But in any local situation, there is a technological solution that could be implemented, but may depend on a number of things. So yeah, I would say the main thing is just to check the local technology, what is available there, and then try to find the local solution. So in a way, there is no one answer for that, because it will depend on a number of local issues. But I would say that for each situation, there is a possibility to do this.
Okay, perfect. I think the best solution is to analyze the environment, try to understand what is the available resources, and think deeply how to use it, or to make the maximum benefit of it.
Yep, correct.
Thank you so much, Dr. Rodrigo, for today's webinar. Again, I have to say it was extremely informative and inspirational at the same time for most of the students, not only me, I'm sure. And I would like to thank all of our fellow students and viewers who have been following this webinar today, and the ones who will be coming later on to watch it on our social channels, either YouTube or Facebook. Thanks all, and thanks again, Dr. Rodrigo, and have a nice day.
You're welcome. Thank you very much. Thank you for inviting me, and happy to do it again whenever you invite me.
Yeah, that would be really kind of you. Thanks a lot. Goodbye.
Bye.